The anti-aging longevity community has a complicated relationship with nuance, and nowhere is that relationship more strained than in discussions of NED plus supplementation and cancer. The dominant narrative in longevity circles positions elevated ND plus as comprehensively beneficial. More ND plus means better DNA repair, better mitochondrial function, better cellular maintenance, better aging outcomes. This narrative is not false, but it's incomplete in a way that carries genuine clinical stakes. Cancer cells have a complicated relationship with NAD+, and the blanket assumption that boosting ND+ is always beneficial for everyone regardless of their cancer history or risk profile warrants serious reconsideration. NAD+ is not merely a maintenance molecule. It's a metabolic fuel that supports rapid cell division. Cancer cells, which divide uncontrollably, often upregulate NAD+ synthesis machinery to support their growth. Several cancer types show overexpression of NMPT, the rate-limiting enzyme in ND+ synthesis, and researchers have identified some cancers as functionally NAD+ addicted, dependent on elevated NAD+ levels to sustain their proliferative metabolism. In this context, supplementing with ND+ precursors is not neutral. It could theoretically provide additional metabolic support to cancer cells in a tumor-bearing individual. This concern is not yet resolved by clinical evidence in humans. The relevant studies in cancer patients using ND+ precursors are sparse, and the existing research doesn't clearly establish either harm or safety in oncology contexts. But the mechanistic concern is real enough to warrant caution and medical involvement. Anyone currently undergoing cancer treatment should not add NAD+ precursor supplementation without explicit discussion with their oncologist. The potential for interaction with chemotherapy, radiation, or targeted therapy is not well characterized, and oncologists are the appropriate decision makers here, not supplement marketing materials. Interestingly, the research landscape includes a parallel thread that runs in the opposite direction. Some researchers are exploring NAD+ depletion, deliberately lowering ND+ in tumor cells as a cancer therapy. NAMPT inhibitors, which block ND+ synthesis in cancer cells, are under investigation as chemotherapy agents. If ND+ depletion can starve tumors, the question of what ND+ elevation does to tumors is genuinely important, and the lack of definitive human data is concerning rather than reassuring. For healthy individuals without cancer history using ND+ precursors preventively, the risk calculus is different. The intent is to support the cellular maintenance processes that reduce cancer risk over time, better DNA repair, reduced oxidative damage, improved mitochondrial function all contribute to cancer prevention biology. Whether this protective effect outweighs any theoretical tumor-supportive risk in a healthy person is unknown, but the theoretical concern is considerably smaller in a non-cancerous context. The appropriate takeaway is neither panic nor dismissal. It's a call for medical engagement and biomarker monitoring in anyone with active cancer, recent cancer history, or elevated cancer risk factors who is considering ND+ supplementation. The longevity community's enthusiasm for ND+ elevation should not override individual medical judgment in populations where that enthusiasm hasn't been safety validated.